Hello students, in last video we discussed a very important topic in pharmaceutics, posology, calculation of child dosage form. It's most important for exam point of view. If you have not seen it, please go through that video as it's crucial for exams. Today we will be discussing pharmaceutical jurisprudence, the most important and repeated schedules for exam point of view. Comes to the topic, first is schedule A. Schedule A is for forms and formats for application of licensing issue, form and formats. Next, schedule B is for fee structure for drug analysis. Next is C1, C1, it's most important and most repeated schedule, biological and special products. Next is D for drugs exempted from the provision of import of drugs. Next, E1, poisonous substances under the Ayurvedic, Siddha and Unani system of medicine, poisonous substances. Next is F standards for running a blood bank. Blood bank is for F. Next is F1 standards for vaccines for F1. Next is F2 standards of surgical dressing is for F2. Next F3 standards of sterilized umbilical tapes. F3 is for umbilical tapes. Next FF standards for ophthalmic preparation, it's most important and most repeated schedules. Next schedule is schedule G. Schedule G is for drugs to be used under the medical supervision. Most appropriate example is anti-diabetic drugs and insulin. It should be given under medical supervision. Next is H prescription drug. It is most important, most repeated schedules for exam point of view. It came up in last year osssc examination. It is most important for exam point of view. Next is J is various disease that cannot be cured for J. Next is M for good manufacturing practices, GMP. M for good manufacturing, M schedule for good manufacturing practices, most important, most repeated. Next M1 for GMP homeopathy. Next M2 GMP cosmetics. Next M3 GMP medical devices. T is for GMP Ayurvedic, Siddha, Unani. Next N is for minimum requirements to run a pharmacy, most important. Next O standards for disinfectant fluids, it's also a repeated and important question. Next P is for life period and storage of various drugs. Next P1 for package size of various drugs, P1 for package. Next Q for coulter used in cosmetics. Next R standards for mechanical contraceptives. Next S standards for cosmetics. Next U maintenance of manufacturing and analytical records of drugs. U1 for maintenance of manufacturing and analytical records of cosmetics. Next schedule is V standards for patents and proprietary medicines. Next is W is list of drugs which can be marketed under only generic name. Next X is list of habit forming and psychotropic drugs, most important schedule. Next and last is Y, requirement and guidelines for clinical trials. Mein schedule is Y. These are the most important schedules for exam point of view. Thank you.